Hi, I'm Colin Hung with Healthcare IT today, and I'm sitting down with my friend Abner Mason here at Health 2022. Abner, welcome back to the program.
Yeah, thanks for having me. Glad to be here.
So I'm excited to talk to you a little bit more about SameSky Health. I know normally we talk about SDOH and other things, and we'll probably get to that later, but tell me a little bit more about SameSky.
So, well, thanks for the opportunity to share some thoughts about SameSky and to describe what we're doing. So, think of us as a health equity technology platform company. What we're doing is helping our clients, and today our clients are in the Medicaid, Medicare Advantage, and exchange space. So the health plans, payers in those lines of business are our clients. We don't work in commercial yet. And the reason health plans hire us is because health plans have always struggled to know who their members are, to really have a connection with the member. I say this jokingly, but it's sort of true. Health plans have sort of excelled at doing the actuarial work that they need to do. They've excelled at collecting the premiums, paying the claims, and rooting out fraud and abuse.
Right.
Those four things plans have been great at. But if you think about it, that's really what plans have been great at. None of that is about establishing a real trusted relationship with the member.
Okay.
So today, it's the case that plans, for example, don't know the race, ethnicity, and language of their members. It's amazing, but they've never collected that data. They don't know sexual orientation or gender identity. We call it SOGI data. They don't know SDOH, or social determinants of health.
Right.
They don't know if a member has food in the refrigerator or not. And so, and that has, that's sort of status quo. But going forward, plans recognize that they have to build a more trusted relationship with their members, a deeper relationship. It's not just about paying the claims. They need to understand who that member is so that they can navigate that member into care at the right time in the right place. They can get those members to come in for required screenings that are part of the Medicaid program, the Medicare Advantage program, and those screenings roll up into quality scores like HEDIS and star ratings. So the plans, it's the right thing to do, but they have to do it now. And the scrutiny on the plans has increased. For example, because of the new focus on health equity, plans are now starting to be required to collect race and ethnicity and language data on their members, but not just collect it, they have to report quality measures stratified by those demographics.
Okay.
So think about this, a plan never had to collect any data. Now they have to know the race and ethnicity, and they have to report quality measures
Based on those
stratified.
Right.
And I think it's a wonderful thing. It's a great moment in our nation's history, and particularly our healthcare system in the U.S., that for the first time we're going to be able to quantify health disparities. We should have done this 50 years ago.
Right.
The truth is we should have done it a long time ago. We know our healthcare system doesn't work well for everyone. I mean, I'm being polite when I say that.
You're being very polite.
There are a lot of disparities, and we've known it, but we haven't been able to do much about it. And I think one of the key reasons is that we haven't been able to quantify the challenge. It's hard, in our society, if you can't measure it, you're not going to make much progress on improving it. And now, for the first time, we're going to start to be able to measure those disparities. And so, SameSky Health comes in that the plans, because they don't have the relationship with their members, they need to establish a relationship. They bring us in because we have figured out that the way to establish that kind of deeper, trusted relationship is to stop treating people all the same.
Right.
One
Not
size fits.
homogenous,
The way healthcare works now is homogenous. If you and I are in the same plan, we would get the same engagement. We're two guys, but you and I couldn't be more different. We have completely different life journeys and different levels of trust for the health system. And so plans recognize now that they're going to have to move away from the one size fits all and actually engage you and me like who we are matters.
Right.
And that's what SameSky Health has developed. We've developed a technology that allows us to do that at scale, to ingest public data, private data, claims data. We built a technology platform that allows us to ingest that data, and it allows us to create what we call an N-of-1 experience for a health plan member. We start to engage with the member, and depending on the way they respond to questions, it changes the journey for the rest of the year. So in effect, we're creating an N-of-1 experience. Your journey is going to be different from mine. And what we found is that when you do that, you build trust. And that's what we're doing at SameSky Health. We're just doing it at scale. We're using technology to, like you and I could, if you and I were just talking, we could have that connection, right?
Right.
But how do I do that with 10 million people?
Right, with all the members.
With all the members, right. So, and that's what we've done at SameSky Health. We built a technology that's allowing us to create that sort of personalized experience, customized, unique to the individual, but at scale.
Talk to me a little bit about the journey and the point in your journey of SameSky Health. How are you guys doing? Number of clients, that kind of thing.
Yeah, so we, I'm glad you asked that because it's an interesting story. I started the company, we've been at this almost 10 years, like 9 years ago. And I have to say for the first 4 or 5 years, it was a real struggle to get health plans and other healthcare stakeholders to talk about what we now call health equity.
Okay.
I mean, in fairness, we weren't using the terms 7 years ago, but we were doing health equity work. We were trying to connect folks who were low income, low health literacy, significantly impacted by the social determinants. We were trying to connect them to care. And it was really hard talking to health plans. It has completely changed. Even at this conference at Health, you've been here. Health equity is a topic that in fact, you can't go to a session and not have people talk about health equity. So what it's done for SameSky Health is it's been a real tailwind. I mean, it is a totally different environment now versus 6 years ago. When I would go to health plans and talk about collecting race and ethnicity language, or even knowing the race, ethnicity of their members,
Right.
they would be like, "That's not what we do.
Yeah. we don't have to do that.
We don't have to do that." And
Right.
because we don't have to do it, we're not going to do it because we don't know how to do it, and we know it's going to take a big investment, so we're not going to do it. And why would we? We know we're doing fine.
Right.
And so it has completely changed. And so for us as a company, SameSky Health, it's a wonderful time for us. A lot of tailwinds. We've got contracts now with 7 of the largest health plans in the country, and we're growing. We're growing across, as I said, Medicaid, Medicare Advantage, and Exchange, and we're looking at commercial lines of business. So my hope is that we don't let this moment pass without really putting into place sustainable policies that will help us create that more equitable healthcare future. We don't want to go back, and sometimes a crisis. And frankly, there was a sort of a crisis in the U.S. There was the murder of George Floyd in 2020, and it transformed a lot of the way healthcare stakeholders thought. The whole country, engaged in a moment of self-reflection like I've never seen in my life. There were marches in the streets, but in boardrooms across the country, including healthcare boardrooms, people said, "This is not the healthcare system we want, and now is the time to change."
Right.
And that moment dovetailed with the COVID and the disparate impact of COVID, and it was. People could see for the first time in really stark relief,
numbers,
right?
yeah.
That it didn't.
It wasn't equal.
It was not. COVID did not fall equally across communities in America. Some communities were sicker than others.
Yes.
And COVID allowed us. It's an unfortunate thing, but sometimes you have to make lemonade out of lemons. No one could say our healthcare system is equitable and is working fine, and we don't need to do anything. So the combination of those two things, the murder of George Floyd and the self-reflection that came from that, and the disparate impact of COVID on communities, low-income communities and communities of color, created this moment that we are in now, and it's made health equity a topic that I think people are really getting serious about addressing.
Yeah.
But we can't let the moment pass. We got to lean into this.
And I'm glad you said serious, because I think before there might have been some talk about it, but now we're starting to see some real action, some real change, and a real awareness around.
It was before it was talk, and I'm not putting down talk, because you need talk to sometimes
to the next part.
But we talked for 30, 40 years. I mean, we've been talking about health equity and disparities and for a long time and not doing anything. And I think what's happened now, and it's really a wonderful moment that we're in, people have gotten serious. I want to really commend CMS at the federal level. And for instance, we do a lot of work with Medicaid. So CMS at the federal level, the state Medicaid regulators, and bodies like NCQA. They've now got a new health equity accreditation. Those folks have come together, and they are putting in requirements for health plans, starting with Medicaid, where they have to collect this rail data, race, ethnicity, and language, and they're going to have to report quality measures out. this wouldn't happen if those regulators and the accreditation groups like NCQA didn't come together and put in place requirements. And so this is a special moment. So I do want to give a shout out to them because they're leaning into this moment. We all do, but it was really important for the regulators to get serious, because that's what's going to cause the other healthcare stakeholders, starting with plans, but providers and health systems and others are not far behind. So I am optimistic.
Awesome. Abner, it's always fun to talk with you. We could probably talk for hours on this topic, but thank you so much for being on the program.
Sure, glad to be here. Yeah.
Oh, and before we go, where can people go to find out more information about SameSky Health?
Yeah, go to our website, www.sameskyhealth.com.
Awesome. Abner, thank you so much.
Okay, great.
This has been Colin Hung with Healthcare IT Today. Thanks for watching.